Assalamualaikum and hi. We are from Group 6 for Subject Deviance and Society Section 1. Okay, so before this, we conduct a research about the smoking impact for youth in Malaysia. So in this video, we will discuss the consequence of the topic but in another perspective. We will present about the impact of smoking on psychological disorder, financial, health and social. Along with that, we will also include the Islamic and Western perspective for a clear explanation and elaboration. Okay, so my name is Nisa Ilyana, binti MD Shahril, matric number 2016066. Okay, so the first point is the impact of smoking on psychological disorder, or we can say a mental health. Okay, we all know that the physical health risks for smoking tobacco, like cancer and everything. But did you know that smoking also affects people's mental health? When a person smokes, nicotine reaches the brain within about 10 seconds. In the first place, nicotine improves mood and concentration, decrease anger and stress, relax muscle and reduce appetite. Regular doses of nicotine changes in the brain which then lead to the nicotine withdrawal symptom when the supply of nicotine decreases. Smoking temporarily reduces this withdrawal symptom and can therefore reinforce the habit. This cycle is how most smokers become nicotine dependent. Furthermore, smokers are more likely than non-smokers to meet current diagnostic criteria for mental health conditions such as mood disorder, anxiety disorder, and psychosis. First, schizophrenia. Schizophrenia is a chronic and severe mental illness affecting approximately 1% of the general population. A meta-analysis of 42 epidemiological studies across 20 different countries show that people with schizophrenia have more than 5 times the odds of current smoking than the general population, and smoking cessation rates are much lower in smokers with schizophrenia compared with the general population. In addition, smokers with schizophrenia smoke more heavily and extract more nicotine from each cigarette. This is because people with schizophrenia use smoking to control or manage some of the symptoms associated with their illness and reduce some of the side effects of their medication. People with schizophrenia have a shorter life expectancy than the general population, and chronic cigarette smoking has been suggested as a major contributing factor to higher morbidity and mortality from malignancy and cardiovascular and respiratory disease. Some people smoke as a self-medication to ease feeling of stress, but research has shown that smoking actually increases anxiety and tension. Nicotine creates an immediate sense of relaxation, so people smoke in the belief it reduces stress and anxiety. This feeling is temporary and soon gives way to withdrawal symptoms and increased craving. Smoking reduces the withdrawal symptom, but doesn't reduce anxiety or deal with the reason someone may be feel that way. In conclusion, we can see that smoking has bad impact on our body not just physically, but also for our mental health. Then, what is the purpose of our life if we enjoy the things that can have a bad impact on our life? This coincides with what Allah says in the Quran, Surah Al-Baqarah, verse 195. أعوذ بالله من الشيطان الرجيم وأنفقوا في سبيل الله ولا تلقوا بأيديكم إلى التهلكة وأحسنوا.
Assalamualaikum warahmatullahi wabarakatuh. My name is Sabrina bin Shahfri. My matric number is 2018838. So today I would like to talk about the impact of smoking on the financial aspect. Why I choose the financial aspect? It is because we can see in Malaysia the cost of one box of cigarette, it is 70 ringgit 40 cent, around 70 ringgit 40 cent to 20 ringgit. because in Malaysia, our government use consumer to pay the tax for cigarette. For me, as a student, we can use around 20 ringgit to buy whole meal food from breakfast until dinner. So it is expensive to me if we want to burn our money to cigarette. Okay, the first impact, I will move to the first impact is smoking household experience serve financial stress because of money spent on cigarette could be used to buy food like what I said just now, or to buy or to pay purchase necessary household items, or as like us as student, we can use that money to buy our reference book or to pay our tuition fee. The second impact is loss of income due to missed work day. Because of smoking, an individual may be a missed work day due to bad health condition. So he or she need a rest in their home until their healthy condition is good. And this situation make his or her get a little income than other healthy person. And the last impact is increased healthcare costs due to the increased risk of illness associated with tobacco use. For example, for smoker who want to buy insurance product, they need to spend more than non-smoker customer. It is because they cost for that package that they want is double price from non-smoker, because the percentage for smoker to admit to hospital is higher than non-smoker. So the insurance company need to charge smoker who want to buy insurance higher than non-smoker customer, because of maybe they heart attack, or they maybe lung cancer because of the use of tobacco in their daily life. So that's all for me. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Azleen binti Mohd Nor with matric number 201634. Today I will be explaining about the impact of smoking on health. Did you know tobacco use is the one risk factor shared by 4 of the main categories of non-communicable disease? These include cardiovascular disease, cancer, chronic lung disease, and diabetes. As a smoker, it not only can affect your health but the health of other people as well. When you smoke, anyone near you will be breathing in the smoke you exhale and the smoke from the end of your cigarette. This is called secondhand smoking or passive smoking. This is harmful for them. Secondhand smoking can cause the same range of illnesses that affect those who actively smoke as well. Net smoking causes most lung cancer and can cause cancer almost anywhere on the body. This includes the lip, tongue, mouth, nose, esophagus, throat, liver, kidney, pancreas, cervix, and others. Smoking is the main cause of chronic obstructive pulmonary disease (COPD), a serious, progressive, and disabling condition that limits airflow in the lungs. Active smoking also worsens asthma in active smokers and is associated with an increased risk of asthma in adolescents and adults. If you smoke, you may feel that your breathing is okay, but your lungs may be damaged even before you have any symptoms. Besides, smoking causes type 2 diabetes, with the risk of developing diabetes 30 to 40% higher for active smokers than non-smokers. Smoking may also worsen some of the health conditions related to type 1 diabetes, such as kidney disease. Smoking increases the risk of gum diseases, tooth loss, and tooth sensitivity. Once a person has gum damage, smoking also makes it harder for their gum to heal. Smoking tobacco can limit a person's ability to taste, smell things properly, and it can also stain the teeth yellow or brown. Lastly, smoking also causes fertility problems and harm to pregnancy women. Smoking cigarettes can damage a female reproductive system and make it more difficult to get pregnant. This may be because tobacco and the other chemical in cigarettes affect hormone levels. In male, the more cigarettes a person smokes, the higher the risk of erectile dysfunction. Smoking can also affect the quality of the sperm and therefore reduce fertility. Smoking during pregnancy can cause problems with the pregnancy and harm your baby. Smoking reduces the amount of oxygen your baby gets and causes harmful chemical to pass through the placenta to them. If you smoke while you are pregnant, there is an increased risk of miscarriage, placental abrasion, your baby being born too early, which is prematurely, and your baby having a low birth weight, which may lead to more health problems, abnormalities of your baby's development, such as cleft lip or palate. According to the Islamic view, smoking is haram. The ban on cigarettes was made based on three main factors, namely smoking affects the health of the smoker himself, smoking harms people in surrounding who have to smell the cigarette smoke, bring damage to the environment, as well as smoking itself, which leads to a waste of money, time, and energy, as well as to detriment of smokers who use them. It's also based on the teaching of Islam that it's the duty of its people to avoid all forms of harm in life, whether behavior or speech. All the harm brought by cigarettes should be given serious attention by all Muslims in our country and should be prevented in their form of awareness and enforcement education. That's all from me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. I'm Nurafrina and I will present about the impact of smoking on the social, or to be more clear, the social impact of smoking. Without further ado, the first impact was the smoker will be experiencing the social stigma and isolation. The smoker will face the smoking stigma that made them feel that they are to be looked down on by society. Stigma, according to Elliot et al. 2010, was a type of deviance that causes people to be judged as unfit for interaction because they are unreliable, unpredictable, inconsistent, or a threat to the interaction. Well, as we can see, smoking is indeed brought harm to people through interaction and communication. Since smoking was one of the unacceptable behavior in society, most people will be intolerant to accept this smoking behavior, resulting in smoker being afraid of getting exposed. They started to be isolated from society and always being alone. Furthermore, if we look from the Western perspective, getting isolated from society or loneliness was something similar to being cut off or separated from others. Western scholars have identified loneliness or isolation experience into four aspects, which are self-alienation, interpersonal isolation such as missing an intimate relationship, agony, and physiological or behavioral distress reaction. Isolation also brings a major effect on human emotions such as being stressed and depressed. While in the Islamic perspective, even though getting isolated was something terrible and can bring depressed for a human, Islam stressed that humans still need to take advantage of that isolation, which is being cut off from others, to change themselves into a better one without the influence of others. For example, instead of getting depressed or stressed about the isolation and stigma that they face, smokers should use the isolation that they get from society to consider back their behavior, whether it is wrong or not, and change their wrong behavior such as smoking into better behavior that is accepted by society. However, Islam also mentioned that if the isolation could not be handled perfectly, it can be a disease that Muslim community should never have to face. Next, the second impact was the freedom of smoker were restricted. The smoker will have their freedom restricted since wherever they go, such as going on holiday or so on, they will always worry about the place where they can smoke. Instead of enjoying the holiday, they will be in stress thinking about the fine which they will get if they smoke in non-smoker area and their desire to smoke. Furthermore, freedom to enjoy their life is also lacking from time to time when they will always get more or judged by non-smoker on what they will do every time they hold a cigarette. In addition, if we can look at Western perspective of freedom, Western concluded that the restriction was a major problem because the concept of freedom in Western was impossible for absolute freedom, but they still can do what they want as long as it fulfills their desire. For example, smoking. This can be mean that the freedom of smokers should not be restricted because it was their own choice. Meanwhile, in Islam perspective, the concept of freedom is acknowledged but constrained and limited according to the Quran and the literature of the Hadith. Islam both uphold and impose some obligation on individuals. This means that even if the smoker freedom is restricted, Islam does not consider it as one of the problems in society because smoking behavior is already unacceptable behavior in Islam and Muslims need to constrain themselves on this type of behavior. In conclusion, there are so many impacts of smoking in a variety of areas, such as in economy, health, psychological, and social. Smoking is very harmful to us, and not only that, but the people around us also can be affected. As long as the smoking behavior will gotten rid of by smoker, the people around them will be better, and they also will avoid taking the life and health of virtuous people. It is time to say no to smoking, even though our Quran does not directly prohibit smoking, but it still gives guidance to human. As mentioned in the Surah Al-Baqarah, verse 195, don't throw yourself into danger by your own hand. From this ayah, we can simplify that since smoking brings harm and danger to our life, it was prohibited in Islam. That's all from us. Thank you very much.